Over 96 million Netflix viewers are still processing a brutal Katie's murder on #1 TV show Adolescence. Jaimie's fate seems to be sealed. But no one seemed to ask obvious question. Why is he having not one, but two psychological assessments? Is his lawyer planning insanity plea? Does Jaimie have psychiatric illness? Can he really get away with a murder? My name is Dr. Ruben Gagarin. I'm clinical child and adolescent psychiatrist in Toronto, and today I'm going to do my own third-party independent assessment and break it down for you. So, is Jaimie insane? Well, only a judge can answer that question, because it is not a diagnosis or a medical term. We do not treat insanity. But it is part of legal defense that called not being criminally responsible for reasons of insanity. To do so, his lawyer has to prove one of three straightforward points. One, that Jaimie did not know what he was doing was wrong. Or two, that he truly did not have control over his actions. Or three, that his actions were driven by mental illness. Well, #1 is out because he obviously knew what he did was wrong because he kept denying it to the police, knowing that he would get in trouble. #2 is a little tricky because he did stab poor Katie so many times in various parts of the body, so he obviously lost it. And he also didn't seem to plan stabbing her, he just wanted to scare her. However, he did not try to stop himself, and he showed in minutes before he actually committed murder, he was in full control, he was following her, he knew exactly what he was doing. So I think that's out. #3. Were Jaimie's actions driven by mental illness? Does he have mental illness in the first place, and could his actions be explained by this condition? Well, a little self-disclosure before we start assessment. I am a clinical psychiatrist. I live and breathe to help people. So even in the first meeting with the patients, I'm not just thinking about diagnosis. I'm trying to understand them and nudge them on the path of recovery. I'm trying to make them feel better. Obviously, Brioni's job is different. She's a forensic psychologist, and her job is to understand his motives and what is Jaimie is about. And to do so, she remains cold, distant, and neutral. Why? So Jaimie can project his feelings into Brioni. So he does. He projects his thoughts into her, and then he blows up and he shows his true colors. There is a sentiment online that Brioni is cold. Well, obviously she is not. She breaks down in tears at the end of assessment, but she's so professional throughout the whole interview that she remains this neutral, remains this professional posture, and she does her job very well. Thank you very much, Brioni. I'm going to start my assessment with trying to understand if Jaimie fits into one of 5 big categories. We cannot cover 297 diagnoses here, so 5 conditions. #1, does he have a developmental disorder? #2, does he have a mood disorder? 3, if it is an anxiety disorder. 4, if he has a personality disorder. And 5, if his actions are driven by psychosis. So, #1, does Jaimie have a developmental condition like a learning disability, intellectual disability, autism disorder, or maybe ADHD? It does not seem so. I'm pretty much sure he doesn't. He reads Brioni very well. They showed Jaimie in various situations he acts according to the social norms. He makes eye contact, he reads her body language, he actually feels threatened when she's neutral and doesn't show her emotions. He tries to manipulate people, so he doesn't have autism. He's very smart. He's thinking very quick, he catches himself, he measures the words, so I don't think he has intellectual disability. He might have a learning disability. We don't know how's his writing or his math skills, but that is really irrelevant. So, #1 is out. He does not have developmental condition. Does Jaimie have mood disorder? There are 2 main ones we want to look into: bipolar disorder and major depressive disorder. Now, does Jaimie have depressive disorder? It is a possibility. He has a hallmark of that condition in teenagers. He is very irritable, angry. He does not seem to be happy. So it is a possibility. However, if he had a severe major depressive disorder, his family would probably notice that. He would probably have problems going to school, focusing, connecting with his friends, and that was not happening. Bipolar disorder is unlikely because by the time we get to Brioni's assessment, Jaimie was in detention for 7 months. So over that period of time, the symptoms would probably show themselves up, and Brioni is not talking about any of those symptoms, so I assume he does not have bipolar disorder, at least, again, not severe. Besides, it is really unlikely to have significant bipolar disorder in a 13-year-old person. It usually happens later. So, number 3, does he have anxiety disorder? The most notable I want to look into is post-traumatic stress disorder, or PTSD. For that condition, a person has to have a history of trauma. Was Jaimie traumatized? Yes, he was. On at least one occasion, his father really scared the rest of the family by being so angry. If Jaimie mentioned it once, it probably happened more. And, unprompted, Jaimie said his father never hit anyone. That makes me think that he probably did. So, what we don't know if Jaimie has actual symptoms of PTSD, like hyperarousal, anger outbursts, feeling numb, nightmares, flashbacks, intrusive memories, feeling numb, avoiding trauma. He doesn't seem to. Jaimie doesn't seem to have other anxiety disorders. He is not generally anxious. He doesn't have panic attacks. He acts appropriate to social situation. So he probably doesn't have another anxiety disorder. Now it gets interesting. Personality disorders. Does Jaimie have a personality disorder? Many people say he cannot because he is not a grown person. I kind of disagree with that. He may have all the symptoms, and even if he cannot call it personality disorder, we still would call it personality disorder traits, so it's still kind of applicable. Well, in personality disorders, we have cluster A, cluster B, cluster C personalities. The first and the last are not really applicable to him. We need to figure out if he has a personality disorder in cluster B, specifically if he has narcissistic personality, borderline, or antisocial personality disorder. Without going into a lot of details, I don't think we have a lot of evidence to say that he has borderline personality disorder. There's no history of self-harm, rocky relationships, etc. So we're going to cross it off for now. I'm more interested if Jaimie has antisocial, narcissistic, or both personality disorder traits. In the younger individual, antisocial personality called conduct disorder, and in the past we called it psychopathy. Jaimie, on one hand, has a very noticeable big red flags of antisocial personality, that is callousness, lack of empathy, manipulativeness. He's trying to intimidate Brioni and manipulate her. He kind of enjoys when he thinks he's succeeding. He's talking about deceased Katie in derogatory terms, and he also describes multiple situations when he tries to manipulate in the interview and outside. For example, he was trying to get Katie to date him when she was at her lowest. So he has a lot of traits. The problem is, to really meet full criteria, he would have to act in a certain way outside that situation as well. So, but his family, his parents and his teachers don't seem to think that Jaimie is not a good person. So he doesn't have a history of arrests or other intimidations outside of that situation, hurting other people, stealing, etc. So it is kind of a question mark. What about narcissistic personality? He clearly, on one hand, sees himself as this powerful and strong person who can intimidate adults, and he enjoys that. That is a bit of grandiosity. I'd say that still counts for a narcissistic personality. On the other hand, he feels that he's actually ugly, and he's one of 80% who is never going to attract women. So you'd say, well, how one person can have both grandiose sense of self and this low self-esteem? It's actually very common. In narcissistic personality, this grandiosity usually is a cover-up for the very poor self-esteem, and the fact that he blows up and he yells at Brioni when he doesn't get his way, when he doesn't get her affection, then that actually proves most likely he has narcissistic personality. See, in my practice, when I see kids with conduct disorder or antisocial personality disorder, they're quite aloof. They most of the time, they couldn't care less about my opinion, about my assessment. But Jaimie seemed to be invested. He really cares about what Brioni thinks about him, and he's trying to use this opportunity to learn how to manipulate women. So I'd say maybe less antisocial, more narcissistic. Now the most interesting one. Is Jaimie psychotic? So we know Jaimie doesn't have autism. He probably has mild depression, possibly PTSD, probably narcissistic personality. And then the question is, does he have psychosis? Psychosis is more straightforward than you think. So there are three main categories. 1, delusion. 2, hallucinations. 3, disorganized behavior. Is Jaimie disorganized, or was he disorganized on the day when he murdered Katie? He wasn't. He planned ahead of time, he wanted to scare her, he had a knife with him, he followed her, and she didn't notice until the last moment. So he clearly was planning, executing his actions, so he clearly knew what he was doing at the time. He was not disorganized in psychiatric terms. So that's out. Does Jaimie have hallucinations? He probably doesn't, because again, he's been in that facility, he was in that facility for 7 months. Staff would have probably noticed him talking to himself, or being lost, maybe standing in the corner, talking to the walls, responding to the voices inside of his head, or maybe seeing something that no one else can. It is pretty obvious, so they would probably notice. Delusions are more interesting because Jaimie is clearly delusional. As a part of manosphere incel community, he probably believes that gender wars are currently raging, that women are trying to suppress and deprive men. So he would defend his male kind by confronting Katie with a knife and scaring her so she stops, and all women in the world with her. But that is actually not a bizarre delusion, because people believe in all sorts of quasi-delusional stuff, like I just described. And what is bizarre delusion? Well, he would be psychotic if he said something along the lines that Katie was actually trying to kill him, that all of this female community actually conspired to deprive him, Jaimie specifically, and they were trying to kill him, possibly, because maybe he knows something that would expose women's conspiracy. In that case, he may feel threatened and scared, and then he may feel as if he needed to protect himself, and that is why he was carrying a knife with him and stopped Katie. But it is not what he was saying. So therefore, we can clearly say he does not have bizarre delusions. He may have misguided beliefs that I personally still would call delusion, but it's just a really misguided belief. So can Jaimie claim that his actions were driven by one of his diagnoses? There was actually a precedent. In 2018, a person named Alec Manasan drove a van into crowded street in Toronto, targeting women. He killed a few people, injured more. And when he faced judgment, he and his lawyer claimed insanity defense, saying that his previous diagnosis of autism spectrum disorder can explain that he somehow didn't understand that him driving a van over people could hurt their feelings. Well, that was dismissed. Can Jaimie get away with a murder? The answer is no, because to claim insanity defense, he first would have to admit that he committed crime and then explain that it was driven by mental illness. Only 1 in 4 attempts are successful in the US and Canada, and something like 1 in 1,000 even tries with insanity defense. And even if he won insanity defense, then instead of going to jail for a determinate amount of time, he would actually be placed in psychiatric facility for indeterminate amount of time, that actually maybe his entire life he would not know ahead of time, with only about review every 6 months. Adolescence on Netflix is a masterpiece. You have to watch it. It is a goldmine for a child psychiatrist who is trying to educate public about mental illness. So, thank you very much for watching. Come back for more. Bye-bye.